Welcome to Suite 250 at Cool Springs Foot Care. I am Dr. Lance Reeves, and today I'm going to talk about ingrown toenails. An ingrown toenail occurs when the edge of the toenail grows into the surrounding skin. This can lead to pain, redness, swelling, and in some cases even infection in that toe. In more severe cases, patients can't even get through their daily activities caused by the pain from an ingrown toenail. It never ceases to amaze me how much pain can be caused by such a little toe. Ingrown toenails can be caused by several different things. One of the most common that I see is improper nail trimming. This means if you trim that nail too curved on one side, that can lead to a little spicule of nail being missed and actually ingrowing into that toe. One problem I see is if patients have an incurvated toenail, meaning it's more curved on the edges, this can be difficult to trim with some of your regular toenail trimmers. So if you don't have the proper toenail trimmer, it's going to be really difficult to trim those corners. Another cause of ingrown toenails is tight-fitting shoes. If a shoe is too tight around the edges of the toes, that can actually push the toenail into the skin, leading to an ingrown toenail. This is very common that I see patients come into the office and say, it all started after I wore this certain type of shoe. So yes, this can be directly related to the shoe that you were wearing when this started. Genetics can play a role. Again, like I've talked about in previous videos, if mom or dad had a history of ingrown toenails, there's a good chance that you're going to have a history of ingrown toenails as well. One cause of ingrown toenails that people don't typically think about is actually a bone spur underneath the toenail. If you have a bone spur underneath the toenail, that's actually going to cause the toenail to lift and the edges are going to curve more. And when those edges curve more as the toenail grows out, that's going to make you more prone to getting an ingrown toenail. Symptoms you can expect with an ingrown toenail are going to be pain, redness, swelling, and in some cases infection, which would look like pus draining from the area. And of course, when you start getting an ingrown toenail, that is when you're most likely to bump your toenail on anything. Your dog is going to step on it, you're going to stub your toe, and it's going to cause much more pain than you normally would have experienced. A couple things you can do to prevent ingrown toenails are trimming your toenails straight across and wearing loose-fitting shoes around the toes. If you are trimming your toenails straight across, you are not going to get those curved edges or miss a possible spicule of nail that's going to become ingrown and painful. Also, if you have a wider shoe around the toe box, you're not going to be prone to that pressure along that toenail, potentially causing it to become ingrown. If you start having these symptoms, there are several different options you can try to get this better. The first one, if you have a very mild case, you can try soaking your foot in warm water and Epsom salts, along with massaging the skin fold away from that ingrown toenail. This can help cause some relief, but in a lot of patients, this is not going to be enough to resolve the issue. Another option is getting a partial nail avulsion. This means a procedure to remove that ingrown toenail and the border of the toenail, which will help alleviate a lot of your pain. This means that you'll get an injection to numb up the toe. This is always going to be the worst part of the procedure because that numbing medication is a little spicy going into the toe, but once it's numb, you'll just feel a little pressure for the procedure, but you shouldn't feel any pain. Once the toe is numb, then I use specialized instruments here to remove that ingrown toenail and make sure there's no remaining spicule or ingrown that's going to cause you any more pain. This is going to alleviate a lot of your pain quickly, and it will allow the nail to grow back in a normal fashion. Hopefully that ingrown doesn't reoccur as that border continues to grow in. The next option is a chemical matrixectomy. That means we use a chemical to kill the nail root to prevent that ingrown from happening again. This is exactly the same as the partial nail avulsion, but at the end of the procedure, I use a little chemical to burn that nail root in hopes of preventing that side or that border of the nail from growing back. Obviously, this is not 100% effective, but I would say mid to high 90s is about the percentage of success rate I see when patients get this one done. Especially if patients have a recurring ingrown toenail, meaning they have it over and over and over again, I do recommend getting this permanent chemical matrixectomy for a long-term solution to your ingrown toenail. One option that's much less invasive but takes a little more time is called the on-affix procedure. This acts as a composite brace that's actually put on the base of the toenail, and as the toenail grows out, this will allow the nail to reshape into a more natural, less incurvated nail. This usually takes 2 to 3 applications of this product to get the full effect and to change the shape of the nail, but this doesn't require any injections, no pain, no procedures. You just come in and get that brace put on and you allow the nail to grow out naturally. The positives of this procedure is it's great for people who are anxious or nervous about an injection because it doesn't require any injections. This is also great for kids and patients with diabetes or other comorbidities who may not be a good candidate for the partial nail avulsion or the chemical matrixectomy. It's always important to seek medical counsel when you're determining which route may be best for you. I typically tell patients whenever you're starting to feel pain from an ingrown toenail, that's when you should get in to be seen. Usually, if you can catch this early, you may be able to avoid a more invasive procedure. A lot of patients will give bathroom surgery a try, and a lot of those patients end up coming to see me because that bathroom surgery wasn't very successful. I recommend against at-home bathroom surgery, especially if you have no experience in this and you're not quite sure what you're doing. If you ever see pus coming from the toe or redness and other signs of infection, that's when you need to get in to see somebody immediately. In that case, you will get antibiotics to help calm down the infection, but that's not going to treat the ingrown toenail. So in that case, you'll need some antibiotics and a procedure to help remove that ingrown toenail from that skin edge. Ignoring some of these signs can lead to much more serious complications down the road. If you have any questions about ingrown toenails or feel that you have an ingrown toenail and you would like some help with it, please call the office at 615-567-5622 or visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.